Everyone, we're going to get started with the afternoon session. Our first speaker this afternoon is Andrea Weinberger. Andrea is a clinical psychologist and associate professor in the Clinical Psychology Health Emphasis PhD program at Yeshiva University's Ferkauf Graduate School of Psychology. She also has secondary appointments in the Department of Epidemiology and Population Health and the Department of Psychiatry and Behavioral Sciences at the Albert Einstein College of Medicine. Dr. Weinberger's research focuses on groups with tobacco-related disparities, including women, sexual and gender minority adults, and adults with comorbid psychiatric, substance use, and medical conditions. She also conducts research on factors related to smoking that can be used to develop behavioral smoking cessation treatments. Dr. Weinberger has published over 150 papers and received grant funding from the National Institutes of Health and Women's Health Research at Yale. Dr. Weinberger is a fellow in the Society for Research on Nicotine and Tobacco and a member of the Communications Subcommittee of their Health Equity Network and a recent co-chair of their Treatment Research Network. Please help me welcome Dr. Weinberger.
Okay, hi everyone. I'm excited to start off the afternoon session. And I first want to say I appreciate the morning speakers getting me started because in almost every talk, we heard some reference to sexual and gender minority individuals, the importance of thinking about gender identity and sex and sexual orientation, and then also the mention of gender affirming care, which I have a bit about at the end of the talk, and it was depending on how much time I had, I was going to go through it briefly, but since it came up, I'm going to try to leave a little more time for it and perhaps ask forgiveness if I go a minute or two over with my talk. First of all, I have no disclosures, no conflicts of interest, and no grant funding to report, and my pronouns are she and her. So for the talk, I first want to define terms related to sex, gender, and sexual orientation that will lead directly into the different groups that I'll focus on in the second part, which is reviewing some of the research on tobacco use, including cessation, and then also factors related to tobacco use, and then have a summary and talk about implications for clinical work and research. So first, to quickly define some terms, sex is a person's biological status in relation to being male or female, or people at birth tend to be classified as either biological male or biological female, but people who don't fit into one of the two categories are identified as intersex. There tends to be an assignment. Most birth certificates ask for you to find someone to be as male or female, but more and more states and other countries are allowing a third option, an X, and Vermont is one of the states that has that option, and so does New York, which is where I live. But many people are identified as male or female. And then gender identity, in contrast, is an internal feeling of maleness or femaleness. So when we talk about, and other identities, so when we talk about sex and gender identity as male or female, we can talk about being cisgender or transgender. So cisgender is when the sex assigned at birth and gender identity match. So somebody who's assigned as a biological female when they're born, whose internal sense of self is as a female, would be cisgender, whereas when the sex assigned at birth and gender identity do not match, such as someone who is born and identified as a biological male, but their internal sense of self is as a female, they would be considered transgender, and specifically a transgender female. There are some people who don't identify as either male or female, and these are commonly known under an umbrella term of non-binary identities. And there's a range of non-binary identities. Some people identify as both male and female. Some identify as neither male or female. Some people identify more female at times and more male at times. So this graphic has some of the terms that are used for non-binary identities, including androgynous, gender non-conforming, gender fluid, agender, and gender queer. This is not a complete list of terms. There are many other terms. There are new terms that come up. There are also some cultural specific terms. So for example, two-spirit is a non-binary related term that comes from the Native American community. To quickly define sexual orientation, these are two definitions that came from the American Psychological Association. The first one is an enduring sexual attraction to male partners, female partners, or both. And then I like the second definition is a bit different from the first, a component of identity that includes a person's sexual and emotional attraction to another person. And as you can see in the first definition, they talk about male and female partners. The second definition really opens it up more to non-binary identities as well. In terms of some of the sexual orientation groups, ones that we most commonly think of are straight or heterosexual, gay or lesbian, bisexual. These all refer to male and female partners. Pansexual is emotional or a sexual attraction regardless of gender identity. So again, including non-binary identities. Asexual, people who don't have a strong emotional or sexual attraction. And then just like gender identity, there are a range of other terms. So one quick point about gender identity and sexual orientation, I do want to clarify and just say that it's two aspects of identity. I won't go through the figure too much, but it shows gender identity is composed of, again, you can think of biological sex, you can think of gender identity, and in terms of classifying people as cis or transgender, while sexual orientation focuses on gender identity and then sexual preference. And I just bring this up to say there's two different aspects of identity, but sometimes in research they're combined. So if you see a group called LGBT, that includes lesbian, gay, bisexual, and transgender people, and I just want to point out that includes 3 sexual orientations, gay, lesbian, and bisexual, and it includes 1 gender identity. It's not always separated in research. And then even though I'm focusing on women and girls, a lot of times LGBT are presented together. So where I couldn't separate it out, you'll see that I present the group together. So that leads me to the groups that I will focus on in the literature in terms of biological sex, people who are intersex, in terms of gender identity, transgender and transgender females, where I can do that, non-binary individuals, and then for sexual orientation, there's a lot of terms that relate to girls and women, including lesbian, bisexual, pansexual, asexual, and so on. And I'll talk about tobacco use research. So this is the prevalence of tobacco use from the CDC across a range of tobacco products in adults. And you can see the top row looks at the overall prevalence of different products. The next 2 rows are broken up by sexual orientation. So first one is heterosexual, and then the next row is LGBT, or lesbian, gay, and bisexual individuals. And you can see that across almost all the products, there's a higher prevalence of tobacco use for people who identify as LG and B. The only product we didn't see that difference was smokeless tobacco. And then in the last column, they have the quit ratio. So that is the percentage of people who reported lifetime smoking, which was defined as 100 or more cigarettes in their lifetime, but don't report current smoking. And you can see that the quit ratio is a little bit less for people who are LGB as compared to heterosexual. They didn't ask about transgenders, or they didn't report data on transgender status in those data. So this is from a different study, and it's from data from the US, but a different year. So it's not the best comparison, but they did have data on different products, including any tobacco products, cigarettes, cigars, and e-cigarettes. Half of the sample were transgender female. And you can see that even without the comparison, you can see it's a very high prevalence of use of tobacco products. This is consistent with some other studies. So this study did direct comparisons of people who were cisgender versus transgender in terms of the use of any tobacco, of cigarettes, e-cigarettes, and cigars. And just focusing again on the women, the black bars, or the black arrows, or the second bar, are the data for transgender females. And then the last bar, and there's dots in there, it might just look like a white arrow, but those would be the cisgender females. And again, you can see across tobacco products, when you do the direct comparison, there's a much higher prevalence of use for different products for people who are transgender female compared to cisgender female. I thought this study was really interesting because they focused on transgender and other gender diverse adults specifically. So there are 5 groups, and they looked at cigarette use, e-product use, cigar use, and then any use of at least one of those products. And looking at the 5 bars, the first one is defined as MTF, which is male to female or transgender female individuals. Second bar is FTM, female to male or transgender male individuals. The third bar are people who identified as gender nonconforming. The fourth bar are people who replied no, which meant that they didn't identify with any of the terms that were options. And then the final bar were people who reported not sure. And I just wanted to point out a couple of things. One is that when you look at sexual and gender minority individuals, there's diversity among subgroups in terms of the prevalence of tobacco use. For a number of these products, you can see a higher prevalence of use for people who responded no or not sure. And you can also see a lower prevalence of use for people who responded that they were gender nonconforming. In terms of data on youth, we're back to the CDC data. This came from 2022. The first rows at the top look at sexual orientation. So again, this is just now prevalence of any tobacco product use. And you can see that there's a higher prevalence of any tobacco product use for youth who identified as LGB compared to heterosexual. And then this was found for both the high school and the middle school age groups. There was also an option for not sure, and that group did not show a higher prevalence of tobacco use. Where you see the dashes, it means it was too few participants to be able to put into the square. They did also have a question that they reported on transgender status, where the options were no, not transgender, yes, transgender, not sure, and I don't know what this question is asking, which was a much smaller sample. You can see that the prevalence of tobacco use was higher for people who are transgender or not sure, compared to those who identified as not transgender. And we saw that with both the high school students and the middle school students. There weren't enough people who said not sure, as a reminder. So moving on to talk a little bit about quitting smoking and what we know about smoking cessation for SGM groups. These are 2 review papers that came out right about the same time that looked at the research that had been published to date. And to skip to the bottom line is that they both summarized that there were promising results. That's most cessation treatments among SGM and, sorry, should have brought water up. Among SGM individuals may work, they help some people to quit. There are some promising abstinence outcomes. However, there's a number of limitations. In the reviews, there were only 19 or 21 studies that they identified. The largest population within the samples by far were gay men. It was a much smaller percentage of the samples that included women, a much smaller percentage that included transgender individuals. For Baskerville et al., there were only 5 studies they identified that even mentioned transgender participants being included. No studies were found on intersex people. These are all on adults, and only one of those studies was on young adults. In addition, in terms of the treatments, there were very few control groups, so it was hard to compare the prevalence of the treatment. Again, promising results, but need for a lot more research, including some of the subgroups. So this study just came out this year, and they were interested in looking at differences in quit-related variables, and also what people reported would be triggers to encourage them to quit smoking. And they compared cisgender and gender minority individuals, and I'll just focus on the data on women. So there were some similarities. So similar number of gender minority women and cisgender women reported the level of heaviness of smoking, the number of attempts to quit smoking, and their plans to quit within the next 6 months. There was also a similar number that endorsed a number of the triggers, including some of the most highly endorsed triggers, such as the price of cigarettes going up and concerns for their own health, as well as having a smoking-related illness, society disapproval of smoking, and smoking cessation related to COVID. Where they found differences were on some of the other factors. So in this case, more gender minority women than cisgender women reported the use of smoking cessation assistance in the past 6 months, and more reported a number of triggers for quitting smoking, including disapproval by family and friends, advice from a doctor to quit, smoking restrictions in public, warning labels on cigarette packs, and anti-smoking campaigns. So we can see some areas of similarity, also some differences that could be used if you're working on targeted intervention efforts. In terms of factors related to smoking cessation, I'm summarizing a list here. You're going to see that a lot of these factors are factors that we talk about when we talk in general about smoking and reasons why people smoke. Some of these are general, and in some cases, they're specifically related to SGM and being an SGM individual. For example, stress, we talk about a lot in being related to smoking and a barrier to quitting smoking and relapse to smoking. SGM individuals have general stressors. They also have specific stressors related to their identity, such as discrimination, homophobia, transphobia, for example. There's a number of life experiences and comorbid psychiatric and substance use disorders that are related to smoking and difficulty quitting, also prevalent in the SGM communities and more prevalent in some cases, trauma, violence, depression, anxiety, and other substance use. Social aspects of tobacco use, again, a broad range across many people who smoke, and also aspects of tobacco use that are appealing, like enjoying flavors, the social connection of it, again. Yeah, if you're interested, I thought this was a great review paper by Walford and Clevenger and colleagues looking at the minority stress model in relation to tobacco use. So I wanted to put that citation up there if you're interested in learning more. And I now want to turn and keep talking about factors related to tobacco use and cessation, but I want to give SGM individuals a chance to talk about it in their own voices. So the next couple slides have quotes from 3 different qualitative studies that included samples of SGM individuals. They were done by Sun and colleagues, Hines and colleagues, and Tan and colleagues. So there's 2 slides that are going to be on factors related to smoking in general, 2 slides on smoking cessation. And next to each quote, I have the first author of the paper where that quote came from, if you wanted to look it up later. Okay, so I'm going to look at that because it's a little too tiny on the slide for me to be able to read them. The first slide is focused on smoking and stress. The first quote is related to stress in general, and the next 3 are more SGM specific. So the first quote is, "So anytime I smoke and I'm really stressed out, I feel like I can feel the stress like melting away, or it feels more manageable at that time." That general relationship for how smoking feels when you're stressed. Like I said, the next 3 are more specific. "We live challenging lives where we have to explain our existence and justify our existence and explain gender and biology and social norms to people on a regular basis, and that's exhausting." The third one, "The drinking, the smoking, it's more to deal with the other things that I've got compounding on me, especially lately since I've been having a lot more gender dysphoria than before." "One of my fellow trans coworkers was harassed, screamed at, and intentionally misgendered, as well as received a torrent of slurs from a woman that came in today, and that definitely made us all want to smoke." The next couple slides are focused on social networks and social support. And in this case, the first 3 are more general, with the last one being more specific. "There are things that make me want to smoke, and seeing anyone else with a cigarette or hearing anyone else talk about having a cigarette is one of those things. I think that when I did start smoking, it was because I was around cigarettes more socially, with friends, with ex-partners. If you have a group of friends that do smoke, then it becomes part of your identity within a group of people." And finally, "Almost every drag king and almost every drag queen smoked cigarettes. It was just like a constant thing. It was part of the social circle. It was part of the bar culture where all of the shows were held." So in terms of smoking cessation, I took a couple quotes related to health. The first one is more general. "But I was also coughing a lot and having a lot of mucus in my throat and having a hard time sleeping because of my coughing symptoms, and yeah." So I think that was kind of when I started thinking about it, meaning quitting smoking. Gender affirming care came up briefly this morning, and I thought these 2 quotes were really interesting related to smoking cessation and gender affirming surgery. "Yeah, that's one of the reasons why I quit the first time when my boyfriend had surgery, because he couldn't have it, obviously, because it would mess with the scars and it messes with healing and all that. So now I would definitely quit doing anything like smoking entirely if I was going to get surgery for sure." And the "it" that he couldn't have would be cigarettes, because it does delay wound healing and there are some other potential complications. And then the best day of my life was getting chest surgery. So I just had to focus on the significance of chest surgery and how important it was for me to come out looking the best it possibly could, and how insignificant cigarettes were compared to that. So if you're wondering how tobacco use is considered with gender affirming surgery, I'll talk about that at the end. That's some work I'm doing with Trace Hines right now. So I can tell you more about that. And then the last one was a couple more slides about social support and quitting smoking. I don't really have a lot of other trans people in my life, but I think having the opportunity to connect with other trans people with similar experiences would be very appealing and helpful in, cessation. And my best friend, life partner, hates when I smoke, so thinking of her makes me want to quit. So with many people who smoke, right, having people in their lives who support cessation, and then specifically being with other people with similar identities who want to quit smoking. So in terms of bringing together what I've talked about so far, we know that there are disparities in tobacco use for SGM girls, women, and individuals in general. In terms of clinical implications, when we work with SGM individuals to recognize these disparities, and when we work with individuals to either motivate smoking cessation attempts or help with smoking cessation and avoid relapse, to recognize that there's reasons for use, reasons for cessation, and barriers for cessation that may be similar to people of other identities, but also unique to SGM identities as well. In terms of research implications, overall, we need more research. I did a lot of literature searches. There is just not much research out there for SGM individuals in general. It was very hard to find anything on SGM girls to even talk about in this talk. Intersex people are nearly absent from the literature. So we need more research overall, but especially in some of the subgroups that have even less research than other groups. In addition, we should consider intersectionality. As I mentioned before, gender identity and sexual orientation are two facets of identity, which means there's an intersection in relation to those two facets, but also with other aspects of identity, such as race and ethnicity, rurality, socioeconomic status. In terms of gender affirming care, this is what I wanted to spend a couple of minutes then talking about, because this is an area, like I said, I'm working on with Dr. Trace Hines. And what we're doing is, because we were interested to start off with, is how tobacco use is discussed in literature on gender affirming care. We're conducting 2 systematic reviews. The first one is on gender affirming surgery, and that paper is under review right now, so I can present some data related to that. The other one is on gender affirming hormone treatment, and we're finalizing the review and working on the manuscript for that one. So I don't have the results for that, but stay tuned. That will be coming. So this slide presents some of the data from the review on surgery. There were 63 articles that we identified that talked about gender affirming surgery and mentioned tobacco in any way in the paper. The top box on the left are the number of studies that were broken down by the different types of surgeries. So the top 2 are surgeries related to people who are trans feminine, and the last one is also multiple surgeries. So we have women included in a number of these areas. 57, most of the studies reported some type of smoking prevalence, and the range we found was 3% to 91%. Pretty much can't get much of a bigger range than that. And one reason we think there was such a big range ties into some of our key points in the paper. Tobacco use was very difficult to tell how it was assessed. It was assessed inconsistently, where different terms would be used within the same study. It was also hard to tell what was being assessed, because for a number of surgeries, patients are required to quit smoking. In which case, if they were asked if they were smoking now, they had a very good reason to report they weren't smoking, and very few of the studies reported biochemical confirmation. It was mostly self-report, or they may have been asking about past smoking. It was very difficult to tell what was being assessed within the studies. If studies required smoking cessation before surgery, very few talked about any services that were being offered. We had only 2 studies that mentioned that assistance was offered, but not more details than that. So we don't know if people are being offered assistance. We don't know what they're being offered. There's very little mention about smoking relapse following surgery, and if there's any type of follow-up care after that. About a little less than half of the studies looked at complications related to smoking and surgery, and we found mixed results, probably partially because some of these other factors that I've talked about, including the assessment of tobacco. So we're now looking at the data on gender-affirming hormone therapy. Just looking at the data, we're going to report some similar things. Tobacco is not being reported very consistently. We don't know what the definitions are. We don't know what the terms mean. Smoking is reported. We think they mean cigarette smoking, but it's not always clear. So we're still working on that data. But just to say, what we know about it is very little. We need to know more. More careful assessment would be useful. And also, it seems like there's a very big opportunity to offer cessation help and to look at it as a teachable moment to help people who are transgender and otherwise gender nonconforming to quit in the long run. And then the last point that I wanted to talk about was what researchers can do in their own studies. One is just assessing a variety of sex, gender, and sexual orientation characteristics, including the range of terms. The more terms that are offered, the more information that we'll have on it. This top paper here was an editorial that Sarah Dermody led with Jamie Hefner and Trace Hines and some of their other colleagues that was published in Nicotine Tobacco Research. They have a great figure about assessing sex and gender and sexual orientation. And then we use that figure in this paper that I listed below, which was a larger effort where we talked specifically about assessing these demographics, plus others, if you're interested, in tobacco research specifically. And we are fortunate enough to have Sarah Dermody and Jamie Hefner working on that paper with us. Also reporting findings. So even if it's a small number of people who report minority identities, just reporting findings and publications is important. The more information that we have, the more numbers we have, even if they're small numbers, the more other people can come back and then put the data together in a review or even a formal meta-analysis. So just the idea of assessing and then reporting what we find, the more that we can learn, the more we can try to reduce some of these disparities. And then again, no grant funding, no conflicts of interest. I want to thank especially the people who I'm working with for the gender affirming surgery and hormone treatment studies. First of all, Dr. Trace Hines, also Caroline Delborgo Patton, who is our amazing librarian at the Albert Einstein College of Medicine, and then the students and RAs within my lab who have been working on either one or both of these review products. And then personally, I also want to thank my colleagues. I'm a part of the Addictions Research Consortium on Sex and Gender because I want to thank them. They're an amazing group of people working on sex and gender and addictions research that always pushed me to think more and think more broadly and just discuss all these details so much. So I want to thank them also. And thank you for listening.
Thank you, Dr. Weinberger. Our next speaker is Jamie Hartmann-Boyce. Dr. Hartmann-Boyce is an assistant professor in the Department of Health Promotion and Policy at UMass Amherst. She's recently moved over from the University of Oxford in the UK, where she retains an honorary contract. She's an editor for Cochrane and leads multiple Cochrane reviews, including those on e-cigarettes. Her particular interests lie in evidence synthesis and the communication of complex information and data to inform policy and public action. Dr. Hartmann-Boyce.
Thank you. Thanks, everyone. It's so nice to be here today. I'm going to be talking about some work that we're doing at the moment, looking at associations between e-cigarette use and subsequent smoking in young people. And particularly for today, I'm going to be talking about what, if anything, we see in that data in terms of patterns by gender and by sex. So I don't have any conflicts of interest to declare, but the work I'm presenting today is part of a broader program of work that's funded by Cancer Research UK. And in terms of what I will cover today, I'm going to start by giving a little bit of a background to that broader program of work and what we're particularly looking at within that. Then I'm going to talk about what the data show when they're analyzed by gender and summarize with conclusions and future directions. So I'm sorry, I can't see my slides here, so I'm going to be looking over there quite a bit, and that's what's happening. We set out to look at this because it is something that is talked about all the time. Are e-cigarettes essentially a gateway into smoking? That is a major, major concern of many communities and has been really since e-cigarettes even became something that was discussed. And though data consistently show that young people who vape are more likely to go on and smoke, whether or not this is causal is something that continues to be contested. People talk about competing hypotheses in this space. So it could be possible that vaping is causing young people to go on to smoke, in which case it's a gateway into smoking. It could be possible that it's a diversion from smoking. So what's meant by that is that kids who might have otherwise started smoking started vaping and never went on to smoke. And it could be an off-ramp from smoking. So it could be that young people are transitioning from smoking into vaping. Though people argue a lot about these, ultimately they could all hold true at individual levels. It could definitely be that vaping acts in these different ways for different individuals. But of course, from a public health level, what we're really interested in is the net impact. So at a population level, is vaping causing more kids to go on to smoke than they would have otherwise? If that's the case, we have clearly a net public health harm that's happening. When we talk about the potential benefit of e-cigarettes, we always talk about them in terms of helping adults to quit smoking. If what they're doing is causing more kids to start smoking, we're kind of canceling out that benefit. But of course, we also should be, and most of us are, interested in whether or not these patterns differ by subgroups and particularly based on socially stratifying characteristics. We know, of course, that smoking behavior does. And so there's very good reason to suspect that it's possible that this relationship between vaping and smoking could feed into that as well. So in terms of the program of work that we're doing with Cancer Research UK, we started at about a year and a half, 2 years ago, and are finishing it up next year. The first thing we've done is an evidence and gap map, and that's basically a way of mapping the evidence that we have so far. So we've gone out, we've collected all the relevant systematic reviews and primary data, which look at whether or not vaping is causing young people to smoke or stopping them from smoking. And we map these on a number of different dimensions, including socially stratifying characteristics. That's under review at the moment. Happy to share it with anyone who wants to see it. The biggest bit of this work, as anyone who's read a Cochrane review will know, is the Cochrane review. That is underway at the moment. And what we're setting out to do in this is assess the evidence on the relationship between the use and availability of e-cigarettes and subsequent cigarette smoking in young people, who we define as those aged 29 or younger, and whether that relationship differs by socioeconomic status, gender, or other possible demographic characteristics. And at the end of this, the final bit that we have planned is a methods consensus exercise to guide further research in this space, to help fill the gaps and to help make sure that the evidence that's going in there is as well conducted as possible to answer these important questions. So in terms of the Cochrane review, we searched evidence into April 2023 this year. So anything published since that won't be in there, but hopefully everything relevant published before that is in there. We talk about two main groups of studies, which are kind of grouped by the outcomes we're interested in here. The main primary outcome we have for this review is what's happening at a population level. So we're looking at the association between e-cigarette use and or availability and change in the population rate of combustible tobacco use in young people. And for the most part, the studies that are assessing this are assessing through the proportion reporting current cigarette use, or where that information isn't available, sometimes some proxy measures as well. And then we're also interested in these secondary outcomes, which tend to much more commonly be assessed via longitudinal cohort studies, which are about these specific behaviors. So initiation of combustible tobacco use, progression of combustible tobacco use, cessation, and so on. And this is where we are so far. So we're just getting into the analysis for this review. We found 21 studies which contribute data on our primary outcome. In Cochrane, it's really important that we don't double count data. This is something that's very important to Cochrane. So where there were studies that used overlapping data sets, we focus on those that have the most data. So let's say one study ranges from 2016 to 2019, the other's just 2016. We're going to use 2016 to 2019. Of those that didn't have overlapping data sets, we see a kind of mixed picture. So there were 16 that didn't have overlapping data sets. 8 of those, so half, suggested an inverse relationship, which basically meant as e-cigarette use was going up, for example, smoking rates were declining, and in some cases more so than one would expect otherwise, because smoking rates in some areas were already declining. 5 of them indicated no difference whatsoever, so not consistent with any of our hypotheses, just no association. And 3 of them indicated a positive association, where the availability or use of e-cigarettes seemed to be driving up smoking. So those were the ones that were consistent with the gateway hypothesis at a population level. When it came from data from longitudinal cohorts, pretty much all of these just looked at smoking initiation. That was the main interest of these studies. Almost all of them, like really, really consistently, and as we would expect from other reviews in this area, find that young people who vape are more likely to go on and start smoking than their non-vaping peers. The studies that we looked at here, most of them didn't even try to assess causality, right? So in their limitations, they would just say, this is just an association. We can't say more about this. Confounding might be playing a part. Some did introduce further methods to try and tease this out. And of those, some concluded it was causal and some concluded it wasn't. And basically, we find ourselves in a situation of still not having a clear answer on that particular question from these particular data that we looked at. But what I'm going to do for the rest of this talk is talk about whether or not this was kind of the same across boys and girls, or if there was any variation in there. And I'm going to start us off with what I'd call our population level studies. So this is when we're looking at population prevalence of smoking. So 4 of our 21 population level studies looked at associations in terms of gender, and 4 of our 46 individual level studies, which included more than 5,000 participants, looked at this. We focused on those bigger longitudinal cohort studies for this sort of thing, just because we knew their subgroup analyses were more likely to be sufficiently powered to look at genuine differences. Loads more studies controlled for gender in their analyses, so they'd match participants or include gender as a covariate, but frustratingly for us reviewers, didn't tell us whether or not there were any associations, whether or not there were any differences. They just told us they controlled for this. So the first of our population level studies, and I'm presenting these in alphabetical order, so no one's getting any particular preference there, was based in the States for 8th, 10th, and 12th graders. And what they were interested in was the impact of e-cigarette taxes on youth tobacco use. And what they estimated was what they call a positive cigarette cross-tax effect, suggesting substitution between cigarettes and e-cigarettes in youth. And what they mean by this is that as e-cigarette taxes went up, as they became harder for people to afford, smoking rates went up and e-cigarette use went down. They do break this down by gender, and we don't see a huge difference in their data here. So in red here, we have their male participants. In orange, their female participants. On the left, we have a more generous definition of smoking. So this is if they'd smoked a cigarette in the past 30 days. And here we see very similar point estimates, pretty wide in precision. And what they're trying to estimate here is the effect of that e-cigarette tax coming into play. So they estimate increases in both boys and girls, any smoking in the last 30 days, and smoking greater than or equal to a half a pack of cigarettes per day in the past 30 days. There, the estimates are slightly more precise, but again, very much overlapping when it comes to male and female participants. Friedman 2022, also based in the US, also wanted to look at associations between e-cigarette taxes and smoking behavior in young people. In this case, it was young adults. And again, what they find, like a book, is that as the e-cigarette taxes are going up, e-cigarette use in younger people is going down and smoking is going up. And here they also give us data split by male and female participants, with males on the left and females on the right. And we don't see any clear differences, although the estimates for females are clearly a little bit more imprecise. They encompass the possibility of no difference for all measures. But there we have for males, recent cigarette use and daily cigarette use both going up with the introduction of these e-cigarette taxes. For females, also going up, but with more imprecise estimates. The third of these studies came out of Massachusetts, and these authors set out to look at a whole range of different policies that were put in place at county levels at the time. The only one that was relevant to our particular work was around prohibiting e-cigarette use in smoke-free restaurants. And they didn't find any evidence that this was having an impact on adolescents' reported use of e-cigarettes. And they also did look at whether or not there was any difference by gender, and they reported that there was no difference by gender in that particular finding. And the final one of these is the only one outside of the US. So this study used data from 4 provinces in Canada, the UK, and Australia, all of which had slightly different definitions of young people. And they use something called an interrupted time series design, where basically they're looking at what happens to smoking trends in these populations, looking at the year that vaping was first kind of widespread introduced into that particular region. They concluded that overall e-cigarette consumption reduced overall cigarette consumption in what they termed environments that enabled substitution. And when we go into this data, it is really difficult to pick it apart. This isn't a criticism with them. It's complex data from a lot of regions with slightly different patterns going on. But here we have, and do forgive all the colors on this slide, the UK and Australia. Those little cross marks are where the differences were statistically significant. So in lines that don't have those cross marks, they didn't detect any statistically significant difference when e-cigarettes were introduced in terms of what happened to smoking rates. And what we see in the UK is that with males aged 16 to 24, I'd argue we see a slight increase there in terms of smoking, but in females, we see a decline in smoking when e-cigarettes were introduced in a widespread way. In Australia, and I've just circled the younger age group there, we see an increase in males and what looks like a decrease in females. So slight differences there, but they didn't go and statistically evaluate whether or not these were statistically significantly different. They just give us these data to look at. So overall, in terms of those population level data, what I would say is that 3 of those 4 studies overall concluded that at a population level, the introduction or availability of e-cigarettes was inversely associated with smoking behavior. So it was maybe consistent with some of those diversion or off-ramp hypotheses, with the exception of Hawkins, which found no difference. None of these studies that looked at it reported a statistically significant difference by gender. And when I tried to dig into these data a little bit more, I really couldn't find any clear patterns there either. I don't think they were necessarily missing anything. I think there weren't any really clear patterns in that particular space. But now I'm going to come on and talk about the individual level studies where actually there were some more notable differences. So again, 4 of these, all of them in the States. So one of the, for this audience, it's okay, but one of the limitations of this data for our Cochrane review is that we can't really say anything that's generalizable outside of the States because contexts differ massively, and we have a predominance of American data here. So in Dwan, they're using path data, and like all of the other studies, they find that past 30-day e-cigarette use at baseline was significantly associated with past 30-day cigarette use at subsequent follow-up waves compared to people who didn't report any e-cigarette use at baseline. So overall, they had an odds ratio of 3.9, so almost a 4-fold increased odds of going on to smoke if you reported vaping at baseline. But interestingly, if you drilled into that, that association was really driven by what was happening in the boys in their sample, where we see an adjusted odds ratio of 6.17, so almost or just over a 6 times increase in the odds of going on to smoke if you vaped. Whereas for girls, it was just at 10% and wasn't statistically significant. And one of the interesting things about these kind of aggregate data is I feel like that odds ratio of 3.9 doesn't actually reflect what's happening in either of these two groups, right? It's kind of almost a misleading pooling of data when we see really different patterns in two different groups. This study looked at different ways to visualize the data from PATH when it came to transitions and sex differences in the youth data. And they used something called set intersection bar plots and heat maps, which it took me a little while to get my head around, but I do think is useful and is at least colorful for our slides, which is nice. So what they have here, and I will try and orient us a little bit, is what they call a calibrated heat map of ever tobacco product use at wave 1. And those are the rows. So each of those rows with its kind of a legend down the right-hand side represents what people were doing at the equivalent of baseline in this study. And for us, we're really interested in the people who reported using e-cigarettes but not smoking at baseline, and the people who didn't report using anything at baseline. And what you see in the columns there are what they report at the next wave, at wave 2, in terms of their use. And the reason this is a heat plot is basically the warmer the color, the more frequent that particular transition was. So as we'll see here, in terms of their e-cigarette users, and they've used 100 to standardize across all of these different rows to help us orient ourselves with them, is that actually the most frequent transition from e-cigarette use at wave 1 to wave 2 was actually not using any sort of tobacco or nicotine product. But obviously there were still higher numbers of those in the e-cigarette group transitioning to other sorts of combustible tobacco products than there were in that top row of people who weren't using anything at baseline. And the next slide is where it gets even more colorful, or in some ways more colorful. Here they're doing the same thing, but they're looking at differences by gender. So what we have again in our rows is what's happening at baseline in these groups at wave 1. And in our columns, again, is what they've transitioned to. But here, the colors, instead of representing the frequency overall, are looking at the females minus the males in those categories. So the warmer colors are transitions that females were more likely to make than males, and the cooler colors are transitions that males were more likely to make than females. And so if we look again at the two lines that I was particularly interested in, which were the people who reported using e-cigarettes and the people who didn't report using anything at baseline, we see that girls were more likely to go on to report using nothing at the second wave than their male counterparts if they had been using e-cigarettes at baseline. So this is also a similar trend actually to what we saw from the previous data, just presented in a slightly different way. Wang is also using this PATH data. They're using something called latent class analysis. Usually I do randomized controlled trials, so I got to learn a lot about different methods in doing this review. And they're looking at transition between different states. And the three that were kind of the states that emerged from their analyses were non-current users, so people who weren't using anything, moderate e-cigarette use, and poly-tobacco user, by which in their sample they really mean dual use of e-cigarettes and combustible tobacco. They concluded that overall e-cigarettes might be a kind of intermediate progression for people moving from no use to dual use, but they found that males were more likely to make these transitions, and females were more likely than males to transition to non-use of any product from being those moderate e-cigarette users at their first data point. So again, really consistent across all of these in terms of these patterns by gender. And finally, our last one, Sun, found a reduced compared to the other ones, arguably due to controlling for additional confounders, but still statistically significant odds of continued smoking comparing baseline e-cigarette users with non-users. Here we're seeing an increased odds of around 80%, but they report that the association was less pronounced in females versus males. And this was regardless of the kind of smoking measure they used. So this included occasional use. They also tested it for more frequent use. And regardless, they found the same pattern of females being less likely to transition from vaping into smoking. So here, in terms of our individual level data, this was like kind of amazingly consistent, which could be a coincidence. We need more data to know, but it struck me as more consistent than I'd expected. I did expect that all of these would show an association between vaping and smoking, of course, But what I didn't expect was that all of them would suggest that that association was essentially driven quite heavily by the males in their samples of young people, and that actually something different seemed to be happening in the females in their samples. So overall, we had these 4 population level studies that provided breakdowns by gender. 3 of them found this inverse association between vaping and e-cigarette availability and subsequent smoking in young people. The 4th found no difference, and there was no evidence of differences by gender. So on this limited data we have so far at a population level, it would be hard to argue that there's clear evidence that vaping is causing more girls and young women to smoke than would have otherwise. When it came to our individual levels, all found at least some evidence of positive associations between vaping and subsequent smoking, but all found those associations were much weaker in females than in males. And so again, with this data, it makes us think that maybe something different is going on in these patterns. And in terms of a gateway effect, it could be that it's acting differently in different populations, which is completely conceivable. And listening to the talks this morning, I couldn't help but kind of start hypothesizing some of the reasons that might be. Now, there are so many limitations to this. This includes risk of bias. So all of the studies included in our review, not to pick on these particular ones, were judged to be at least at some risk of bias according to the tools we were using. I would like to say that these tools were strict, but not impossible, right? You could conceive a study that ended up being at low risk of bias using the tool we were using, but none of these studies met that. I think it's quite likely that there was selective reporting here. Overall, we know that studies that find statistically significant things are more likely to be published, but that becomes even more the case when it comes to subgroup analyses, because what a lot of people do, and I'm sure I include myself in this too, because we all have limited word count in journals, is we look at associations that we've pre-specified, the ones that seem exciting get reported, get all the data thrown in, and the ones that don't end up kind of being eked out and maybe not as clearly reported and not contributing to analyses in the same way. There is little to no data on other gender identities. We really wanted to look at this because we thought this was one of these subgroups where patterns might differ. So we included it as one of the columns in our evidence and gap map so that we could say, let's filter it and find out how many studies looked at other gender identities, sexual minorities, nothing basically. I think partly because often these groups were in small studies with small samples and essentially they couldn't report the data on them. I like to think that's what's going on, but it could also be that people just aren't looking at this, and it definitely needs to be looked at. And very little data on intersectionality. So particularly for us, we were really interested in socioeconomic status as part of this particular review, and very, very few studies would tell us what was happening when you combined, let's say, both gender and socioeconomic status. So there's a lot we don't know. Almost all the data is from the States. And usually I would be presenting to you a beautiful meta-analysis, which was really easy to understand with one diamond. And I could say, this is the effect estimate, but I can't do that today. These data were really heterogeneous methodologically. So in terms of the way people collected data, in terms of the way they defined their outcomes, and in terms of the statistics that they used from their analyses, it would just be probably quite misleading to try and combine them into one estimate. So we need more. I don't always say we need more studies. I usually do. We definitely need more studies designed to evaluate causality in this space conducted outside of the US. There's a lot of reason to think that the context in which e-cigarettes are promoted and the ways in which they're promoted and used might affect what happens with subsequent smoking. We need studies that look at socially stratifying characteristics, included but not limited to gender. And I think it's really important that we acknowledge uncertainty in this space overall. I sometimes hear people say that there is lots of certainty that e-cigarettes are a gateway into smoking. I'm not sure, based on the data we have in front of us, that we can say that that is universally true. I don't think we can say it's not true either. I think we don't know, and we need better studies on that before we can say anything definitively. So that's it from me. Thank you so much to all of you for listening. I also want to give a shout out to the authors of these studies who actually did these analyses and reported them, which was super useful. So thanks a lot.
Thank you very much for that. Our next presenter is Eli Klemperer. Dr. Klemperer is an assistant professor at the University of Vermont in the departments of psychiatry and psychological science. Our training program was mentioned earlier this morning. Eli was both a predoctoral fellow and a postdoctoral fellow with us in that training program. As an investigator with the Vermont Center on Behavior and Health, Dr. Klemperer's research primarily develops clinical and regulatory interventions to reduce harm from tobacco use, with a particular focus on nicotine reduction and dual users of cigarettes and e-cigarettes. In addition, Dr. Klemperer has a growing program of research on the treatment of opioid use disorder among people who are incarcerated or recently released from incarceration in rural communities. Eli.
There's like a window above here. Can I just close that? There, good. That'll work. Okay. Hi, everyone. Thanks for the introduction and all the wonderful presentations today. Very excited to talk to you today about my presentation here on dual use among women in the United States. First, I want to acknowledge the co-authors that helped out with this project and where it is so far. Lauren Koch, postdoctoral fellow here in the VCBH, who led the analyses that I'll present today. Mark Feinstein, my graduate student, Katya Marsh, research assistant, and Steve Higgins, the director of our center and a research mentor of mine. So here's my disclosure and funding information. So before I talk to you about the analyses we did for this presentation, I want to go over a little bit of background on dual use of cigarettes and e-cigarettes more broadly, and then we'll focus in on sex differences. So as many of you are probably aware, dual use of cigarettes and e-cigarettes is now the most common combination of tobacco products in the United States. And when we're thinking about the dual use of these products, I want to just step back and think about the similarities and differences between e-cigarettes and e-cigarettes, especially when they're used simultaneously. So I think that's summarized nicely by David Abrams and colleagues' figure in his 2018 paper, where you can see on this plot both the potential harm, the potential appeal, as well as the abuse potential or dependence of these products. And what we have, I think to summarize this, we have two sources of nicotine with different delivery mechanisms that are similarly appealing, especially with newer generations of e-cigarettes, but differ vastly in terms of harm potential. And most experts agree on this. A number of reviews have come to similar conclusions. Because of this, a lot of us in the room and tobacco researchers focus on shifting people from the right to the left. We work to try to get people to switch from combusted to non-combusted products, which would result in harm reduction. Today, I want to talk about that group of people who have essentially gotten stuck using both, or for whatever reason, end up using both cigarettes and e-cigarettes simultaneously, and how we should be thinking about these folks, as well as sex differences. So most people who smoke in the United States and start using e-cigarettes do so with the intention to quit or cut down on cigarettes, which is important to keep in mind here. About half of these folks become established dual users. And what I mean by that is if you take people who smoke and follow them after they start using e-cigarettes, 6 to 12 months after that, about 40 to 50% will report regular use of both of these products. Now, I want to make the case that this is a distinct group of people that we can be thinking about as separate from people who exclusively use cigarettes or who exclusively smoke cigarettes. So by definition, these folks are using two products. These products differ in their pharmacological profiles. They also have unique behavioral repertoires. So people who dually use both of these products will often report longer and more frequent bouts of vaping in addition to combusted cigarette smoking. And then there are some important social differences. So using e-cigarettes in settings where smoking is prohibited is something that's fairly common among dual users and results in a different repertoire. Now, for many of us, the bottom line is, well, what happens to combusted cigarette smoking among dual users? That's the most harmful product. That's what we all, many of us are interested in. And now there's some compelling evidence from a number of different nationally representative data sets that people who are dually using cigarettes and e-cigarettes who use their e-cigarettes daily are most likely to go on to quit smoking, which is harm reduction, especially compared to those who use non-daily and even those who don't use e-cigarettes at all. Dual users who use non-daily, so people who smoke cigarettes and occasionally use their e-cigarettes, appear less likely to quit smoking than those who don't use e-cigarettes. Again, these are all self-selected populations. Now, unfortunately, in the US, most dual users, or people who report use of both products, use cigarettes daily and use e-cigarettes non-daily. Again, a self-selected population, but this is what we're left with when we're talking about dual users in the US. So what do we know about dual use among women? Quick review of the literature here. One review done by Dr. Coleman and colleagues, in the audience today, concluded that the prevalence of dual use does not appear to differ by sex in the US. In PATH, what we see is approximately, this is a recent publication by Dr. Corsani and colleagues, and one of their secondary findings here was around 81% of female dual users and 70% of male dual users continued smoking 1 year later at subsequent follow-up, which is indicates there could be some signal here, some difference between sex. And then in Megan Piper's natural history study, where she followed a cohort of dual users for 1 year, she found no differences in the rate of transition in products over that year. So before I talk a little bit more about how we built on this, I think it's important to think about what kind of treatments exist for dual use at the moment. And there's not much. So there have been 2 published studies so far. First by Martinez and colleagues, large randomized clinical trial assessing self-help for dual use, randomized participants to assessment only or standard self-help mailings, readings about smoking cessation, or those same mailings but tailored for people who use cigarettes and e-cigarettes, found that the tailored self-help increased cessation more than increased smoking cessation more than assessment only, but no different than the standard self-help. They did test differences by sex, and there were no differences by sex. Vickerman and colleagues published a feasibility study recently, did not test sex differences, largely showed that telephone counseling is feasible among dual users. Okay, so building on this, we want to explore using some nationally representative data, 3 specific aims here. The first is to simply report the prevalence of US women who smoke and also use e-cigarettes, these dual users, and how that's changed over time in the US. The second is to describe women who dually use cigarettes and e-cigarettes, both in terms of their demographics, as well as tobacco use characteristics. And then the third point is evaluating whether their likelihood of transitioning to cigarette abstinence differs from men who dually use cigarettes and e-cigarettes in the US. So to do this, we use 2 nationally representative data sets in the US. The first is the National Health Interview Survey. We use 7 waves of data here, examining the prevalence of dual use by sex, using serial cross-sectional surveys from 2015 to 2017. We also used the population assessment of tobacco and health, establishing a cohort of dual users at wave 4, and then following them into wave 5 to examine whether transitions to cigarette abstinence differed between men and women. Together, I think they complement each other nicely. NHIS has nice snapshots of nationally representative data in the United States. PATH is intended to be a cohort study, to examine more detailed information on different tobacco products use and how those change over time. So dual use was defined similarly in both data sets. For cigarette smoking, they had to have over 100 lifetime cigarettes, plus currently smoke every day or some days. For e-cigarette use in PATH, we had this variable where we could talk about history. And so they had to have ever used e-cigarettes fairly regularly. And then in both PATH and NHIS, e-cigarette was defined as current use on every day or some days. You'll notice these are fairly broad definitions of dual use. I think that comes with some pros and some cons, but important to keep in mind as you're interpreting data here. I'll also just note the rise of nicotine salt-based e-cigarettes. It's around 2017. So prior to that, the information, the studies that I talked about on the slide presenting data on what do we know about women and dual use, those data largely came before 2017, before the rise of Juul and other pod-based nicotine salt e-cigarettes. So we're excited to take a look at this here. So to start with, using NHIS data, just looking at the change in the prevalence of dual use over time by men and women, and this is among cigarette smokers. So on the y-axis there, that's the percent of cigarette smokers who are also using e-cigarettes. And we have the blue diamonds and the solid lines representing women and the dashed lines representing men. What we can see is dual use hovers pretty consistently between 10 and 15%, with the exception of 2020. NHIS went to a slightly different methodology in 2020 due to COVID-19 at a much smaller sample size. And so there's reason to believe that could be an artifact of COVID-19 there. Otherwise, pretty consistent and no differences by sex, which is consistent with prior literature. So then moving on to PATH, first we established our cohort of dual users in wave 4, a little under 1,600 respondents. And here's what they look like collapsed across sex. I'll get into sex differences in the next slides. You can see most were under the age of 44. Most had high school education or more. Most were white, non-Hispanic. And it's not on this slide, but 49% were women. So the next, we wanted to examine transitions over time from wave 4 to wave 5. Now, this is an alluvial plot, and I'll walk you through it point by point because it can get a little bit confusing here. So on the left, we have dual users separated by women and men. The bluish bars on top are women, the bluish bars on the bottom are men. And as you follow it from left to right, let me see if I can, oh, there we go. You can see here, 44.9% of women dual users in wave 4 transitioned to continue dual use in wave 5, whereas 43% of women dual users transitioned to become exclusive cigarette smokers. Far fewer transitioned, I've lost the mouse. Far fewer transitioned to the bottom two boxes to become exclusive vapors or completely abstinent. In men, you can see similar trajectories. 45% continued dual use, 35.8% transitioned to exclusive smoking, and far fewer transitioned to either exclusive vaping or complete abstinence at wave 5. So from left to right, we go from wave 4 to wave 5. Now, as I mentioned before, most of us are interested in these bottom two boxes, which unfortunately are the smallest, where we're looking at individuals who have quit smoking, transition to either exclusive vaping, which is harm reduction, or complete abstinence. So that's what I want to focus on this slide here. So same data as the last slide, but now we're just simply comparing between men and women, dual users. How do they compare in their likelihood of transitioning to cigarette abstinence? Not worrying about e-cigarette use, but just cigarette abstinence in wave 5. What you can see is 15.8% of women dual users transition to cigarette abstinence, whereas 21.8% of men transition to cigarette abstinence. That was significant, so equating to about a third less likely to transition to cigarette abstinence among women dual users. Now, these are unadjusted, just raw comparison here between men and women, but a snapshot of the differences between men and women dual users in the US. So in this next slide, I'll show you data from our multivariable model where we do adjust for covariates to start to see, does this relationship persist if we account for covariates. To start with, that's the exact same odds ratio you saw on the last slide. I've just put it on a forest plot so you can keep it in comparison as I present covariates here. And we added covariates using Karen Kaza's analyses as a precedent, as a model here of her path papers, specifically the most recent published in JAMA Psychiatry. And what you can see is the colors are hard to make out, but the adjusted model is everything below that first line. And importantly, when we add these other covariates in, the effect for sex is no longer significant. So still trending in the same direction, women dual users less likely to transition to cigarette abstinence than men, but the error bars overlap with one indicating it's not significant. Well, what can we learn from this? Well, if we start to look down at the covariates, and again, based on Kaza's work, we included age, race, ethnicity, education, and then markers for tobacco dependence. We start to see some of the usual suspects driving this relationship. So this is consistent with prior research on smoking, as well as dual use. But what we see is that older respondents who are dual users at wave 4 were less likely to transition to cigarette abstinence at wave 5. You see that individuals who identified as Black were more likely to achieve smoking cessation at wave 5, although this was marginally significant, error bars overlapping 1 just barely there. And then in terms of education, greater education attainment was associated with an increased likelihood of smoking cessation. And then in terms of markers for cigarette dependence, time to first cigarette being smoked within 30 minutes is thought to be the best predictor of smoking dependence. And here we see, consistent with prior research, those who smoke within 30 minutes of waking were less likely to achieve cigarette abstinence at wave 5. Similarly, those who used e-cigarettes non-daily were marginally less likely to achieve cigarette abstinence at wave 5, although error bars do overlap with 1 here, indicating non-significance. So on these next slides, what I'd like to show you is those same covariates broken down by sex. So what might be happening here, we saw unadjusted model, women are less likely to transition to cigarette abstinence, but women dual users may look different than men dual users in the United States. So here I'd like to dive into that a little bit and see how do women versus men dual users look in the United States. So on the left, we're taking women versus men dual users at wave 4 and comparing them by age. And if you follow those bars from left to right, you'll see that in the young adults, 18 to 24, 25 to 34, the young adult categories are significantly more likely to be men dual users than women dual users. As you follow those bars up, the relationship switches, and you can see that older adults are more likely to be women dual users than men dual users. Now, if you recall that last slide, being older was associated with a decreased likelihood of smoking cessation, which could be driving some of the effect we saw for women there. Going on to race ethnicity, we don't see differences by race, but do see that women dual users were less likely to identify as Hispanic than men dual users. Moving on to education, and this was a very strong driver in our model, one of the covariates highly associated with smoking cessation among dual users. But here we do not see any differences by sex among dual users. And then interestingly here, we're looking at tobacco use characteristics, and the bars on the left, let's see if I can get my bars on the left represent time to first cigarette. And you can see women were significantly more likely to report smoking their first cigarette within 30 minutes than men dual users. One of the best predictors of cigarette dependence, and again, significant in our model. And so this difference between men and women could also be contributing to the overall decreased likelihood of smoking cessation among women dual users than men. We didn't see any difference in terms of time to first e-cigarette, which is the next set of bars. Moving over further to the right is the difference between daily versus non-daily cigarette smoking. And women were more likely to be daily cigarette smokers and marginally less likely to be daily e-cigarette users. So what that might translate to, we know that daily e-cigarette use is associated with increased likelihood of smoking cessation, and the opposite is true for daily versus non-daily cigarette smoking. So combined, this might be contributing again to that decreased likelihood of smoking cessation among women who dually use cigarettes and e-cigarettes. So lastly, we took a look at reasons for e-cigarette use. Now, this was not included in our model, but thought that this might be interesting and important to look at for this conference in particular. And first, I want to draw your attention to so these are all the reasons that PATH offers that people can select for why they use e-cigarettes. Again, these are dual users, people who use cigarettes and e-cigarettes. And I want to draw your attention to the bars furthest to the right. No differences by sex, but I think very important to keep in mind that the majority, around 70%, consistent with prior research, report using e-cigarettes as a way of cutting down or quitting their combusted cigarette smoking. Also consistent with some prior research, if you look at the two marginally significant effects there, so error bars just overlapping, women are more likely to report e-cigarette use for reasons of social acceptability, which we saw in an earlier presentation as well. The two reasons here are because e-cigarettes don't smell and because they may be more acceptable to non-tobacco users. So interesting ideas to follow up with in future research. Okay, so pulling this all together, I think the big finding, again, unadjusted here, is that we found that US women versus men dual users were less likely to quit smoking at wave 5. When we did adjust for covariates and started to explore those covariates, we're seeing some initial signals that perhaps this could be driven by the fact that women dual users look different than men dual users in the US. They appear to have greater cigarette dependence, appear to be more likely to have non-daily e-cigarette use, and they're an older age than women versus men. Also of note, we see that both women and men dual users report using e-cigarettes to cut down or quit their cigarettes, but women also appear more likely to endorse using e-cigarettes for reasons of social acceptability. Now, there are lots of limitations to this. This is purely exploratory. We went into this just trying to look around and see, what can we learn about women dual users, correlational in terms of the fact that these are observational longitudinal data sets, not experimental, and relying on self-report and long-term retrospective recall, also not accounting for products other than cigarettes and e-cigarettes, which is very important for next steps. But I do think we can learn some things from this. The first is that if we can replicate this, then there's need there may be more need to have for smoking cessation treatments among women versus men if this disparity persists. And as treatment is developed, we need to be testing these separately by sex, make sure that one group isn't left behind. And I think, as evidenced by our multivariable model, future research is needed to look at intersectionality in particular, and cumulative vulnerability. So it's clearly not just that women per se who are dual users are less likely to quit. It's all of the things that are experienced, the way tobacco is used, difference in demographics that might contribute to this. So future research could help to tease that apart. So with that, I'll stop. I think we're saving questions until the end, but I do want to put a plug in. If this is a topic that interests you, the poster session in just a few hours has some great posters, 3 of which are listed here that get into this population and intersection between cigarettes and e-cigarettes a little bit more. Thanks.
Thank you, Eli. Okay, our last speaker for this afternoon session is Danielle Davis. Dr. Davis is an assistant professor of psychiatry at the Yale School of Medicine. She received her PhD from the University of Vermont, another T-Course training program graduate from UVM, working with Steve Higgins. She currently has a K01 career development grant to examine sex differences in sensory perception of e-cigarette flavors among adults who smoke cigarettes. She's also a co-investigator of the Yale Tobacco Center of Regulatory Science, and her research focuses broadly, including understanding how nicotine and sensory attributes of tobacco products like flavor can contribute to use and dependence of these products. Danielle.
Hi, everyone. So I just want to first say it's exciting to be the last talk in the session because so much good information was covered by the other speakers. So I don't have to spend too much time on certain slides. I think, Diane, you said the same thing. So I'm Danielle Davis, an assistant professor at the Yale School of Medicine. And as mentioned, I have a KO1 to look at sex differences in response to sensory perception of e-cigarette flavors. That project will be starting hopefully in the next several weeks. And I don't have any conflicts of interest to disclose. So the objective of this talk today is really to investigate the human laboratory research investigating e-cigarette use behavior among women. So alternative nicotine delivery devices, namely e-cigarettes, are commonly used and heavily studied products, but there's limited experimental evidence of how those products are used by women, and that's what I'll be talking about today. I'm going to review the human laboratory research on use of e-cigarettes among women. I'm going to identify some of the gaps in the research and our knowledge, and I'm going to discuss ways to address these gaps. So Andrea had some fabulous slides on sex and gender, so I'm not going to spend too much time on them, but I just want to distinguish that they are separate classifications and should be considered separately. And I think in tobacco research especially, we have some room for improvement in how we talk about sex and gender, and so it's important, especially in laboratory research, to distinguish and define these terms when possible. And I do also want to talk briefly about e-cigarettes in women and the rates of use in this population. And Dr. England in her talk this morning presented some rates of use from different data sets, and I'll present that look almost identical, which is comforting. So this is data from the National Health Interview Survey looking at adult e-cigarette users. And what you can see is that women's e-cigarette use across all age groups is 4%. It's significantly lower than male use. And then importantly, rates decrease as age increases for e-cigarette use. So what you see on the slides here, or on the slide here, is that you have the e-cigarette use split by age. So you've got 18 to 24, 25 to 44, and 45 plus. And you can see that among each age group, that difference between men and women is there, where women have a slightly lower rate of e-cigarette use compared to men, though it's only significant in the 25 to 44-year-old age group. Now, among youth data, we see the reverse. So we see that females, and this is from the National Youth Tobacco Survey, and they're using sex as the classification, whereas the National Health Interview Survey is using gender, just to note. But we see that females have higher rates of use than males in both high school and middle school data. So 15.4 versus 12.8% of females, high school females versus high school males report current e-cigarette use, so past 30-day e-cigarette use, and then 5.3% of middle school females versus 3.8% of middle school males. So the youth data is really something to consider when trying to envision what future adult populations of e-cigarette users might look like. And when I'm talking about e-cigarettes, I'm talking about a wide variety of devices that evolves quickly, more quickly than it seems we can design studies around. So I just want to briefly talk about, what e-cigarettes are. So what I have on this slide here from left to right is sort of the development of e-cigarettes since their initial iteration. So we first started with cig-like devices, which looked and were shaped like combustible cigarettes. They were used several times and then disposed of, and they were really advertised as products to replace a cigarette. We then saw the We then saw vape pens and advanced personal vaporizers, or the large tank-like devices, come onto the marketplace. These are refillable e-cigarettes, and what you would do is you would buy your e-liquid separately, you put it in these devices. And with these devices was really the development and the proliferation of flavors. For e-cigarette flavors, there are thousands of different combinations and variations of flavors. And as Eli mentioned, in 2017 or so, we saw rechargeable pod devices enter the marketplace. So Juul devices being the most popular, but also some others such as the Soren Drops, Soren iShare, and then Views has a few pod devices as well. These are similar to vape pens and mods, also are rechargeable devices. You, however, you buy the pods, which are pre-filled with e-liquids, and you place it on the device. When that pod is empty, you replace the pod. What's notable about these devices is that in 2020, the FDA restricted the flavor availability of these. So these rechargeable pod devices are only available in tobacco and menthol flavors right now, which kind of left an opening in the market for the current e-cigarettes that are, I would say, overtaking Juul in terms of popularity. And these are disposable e-cigarette devices. So this is the final set of devices on my slide. These are devices that are available in a variety of brands, a variety of flavors. They look a lot like the rechargeable pod devices, but they are meant to be disposed of. They advertise anywhere from 1,000 to 10,000 puffs in the device. Some of them have USBs to recharge the battery if you haven't finished the e-liquid by the time the battery dies. And something to note about these devices is the brands are really transient. So Puff Bar, for example, which I have up here, was one of the more popular devices in the past couple years, but now is not available in nicotine. They have swerved to be a THC and a non-nicotine e-cigarette device. So this disposable iteration of e-cigarettes is really always evolving. So with e-cigarettes, there are quite a few features that enhance appeal. There's maybe most importantly nicotine that's influencing appeal, and I'll talk more about nicotine in these products. There's also flavor. As I mentioned, there are thousands of available flavors in e-cigarettes that enhance and influence appeal. There's size and shape of the device. There's the type of device. So there's all these different versions of e-cigarettes that I mentioned, and that influences the appeal. And then there are things like the cost of the device, the availability, how easy it is to get, and then the popularity or the social perception of these devices. Now, as I mentioned, I'm really focusing on human laboratory work today. So I'm going to be focusing on two of these features of e-cigarettes, nicotine and flavor. And so starting with nicotine in e-cigarettes is really characterized by two main components: the concentration of nicotine in e-cigarette and then the type of nicotine. So nicotine concentration is just the amount of nicotine in e-cigarette, and concentration ranges from very low to very high levels of nicotine. And nicotine in e-cigarettes is available in two different types, so freebase or nicotine salt. And nicotine salt is really what is most commonly available and popular on the market right now. And nicotine salt also allows for a higher concentration of nicotine. Lab studies looking at nicotine salt have shown that it's less irritating and it has higher appeal. And yeah, nicotine salt is the most commonly available nicotine form on the market, as I mentioned. So what do we know about nicotine concentration and type in e-cigarettes and how it relates to women's use of these products? So there's really limited human laboratory data on differences by sex or gender in response to e-cigarette nicotine concentration or type. So to understand these features, we really have to turn to data on non-e-cigarette products, specifically for nicotine concentration. And then for nicotine type, we can look at recent human lab data to inform how women might be impacted by these products and to inform how we might conduct future laboratory studies. So for nicotine concentration, there is some research that suggests that women may be less sensitive to changes in nicotine concentration compared to men. I think, again, this was mentioned a couple times today, but we've seen in cigarette cessation trials using nicotine replacement therapy that women have demonstrated a pattern of poor cessation outcomes. We've seen in nicotine nasal spray studies that women were worse at distinguishing nicotine nasal spray from nicotine-free nasal spray. So when administered a nicotine nasal spray and a nicotine-free nasal spray, men were better at identifying which one contained nicotine. And additionally, women were less confident in the accuracy of their ability to discriminate between the nicotine and the nicotine-free nasal spray. However, we see in studies of combustible cigarettes some pretty mixed results. So some studies have showed differences in discrimination of the sensory effects of cigarettes with different levels of nicotine, while others do not. And so I want to talk a little bit about this data because I think what we see can inform how we might be able to understand nicotine concentration in e-cigarettes among women. So there's two studies I want to highlight. One is Perkins et al. 2018, and one is Streck et al. 2020. This was done at UVM and is a secondary analysis of a larger lab trial here. So in Perkins et al. 2018, women and men were given two different cigarettes, one with a very low level of nicotine, which is represented by those white bars, and one with a much higher level of nicotine, or normal nicotine content cigarette, represented by those black bars. And they were asked to rate these different cigarettes on a variety of features. So how much they liked the product, how satisfying it was, how strong it was, how much nicotine it delivered, its flavor, and how similar it was to its own brand. And in this data, they looked at differences in ratings by men and women. And so what you can see is that women rated these products more similarly than men. And this was significantly so across all items except for the item of liking, which was marginally significant. So you see here, women are saying these products are similar in strength, similar in satisfaction, whereas men are showing a greater discrepancy between their ratings. So this data gives some evidence that women may be poor at discriminating nicotine in products of varying nicotine concentration. However, data again from UVM, which is a secondary analysis by Joanna Streck, does not show this difference. So in this study, there are 4 different combustible cigarettes of varying nicotine concentration from very low to normal nicotine. And this is indicated by the different colored bars on those graphs there. The lightest colored bar is the lowest concentration of nicotine, and the darkest colored bar is the highest concentration of nicotine. And what I'm showing, she looked at a variety of outcomes. I'm showing satisfaction and psychological reward here. And what you see is that there's a graded effect of satisfaction and psychological reward on, or there's a graded effect of nicotine concentration in terms of the rating of satisfaction and psychological reward. And there's not a significant difference between men and women. Both men and women increased their ratings of these two outcomes as nicotine concentration increased. There's also extended exposure studies at UVM that did not show effects, differences by men and women. So taken together, there's some evidence that there may be a difference in the perception of nicotine concentration between men and women. However, again, there's really limited investigation of this in the lab in e-cigarettes. We know that generally among nicotine-dependent populations, higher nicotine concentration is associated with higher reward and appeal in e-cigarettes. We also know that at certain levels of nicotine in the e-cigarette, irritation effects may limit appeal and reward. So that's something to consider. When we look at nicotine type, similar to concentration, there have been very few lab studies, or there have been really no lab studies distinguishing between men and women, specifically looking at these differences. But there have been a couple laboratory studies which compare nicotine type, so free-base nicotine versus nicotine salt. And again, these studies don't report effects of sex and gender, but what they tell us may inform how women may respond differently to these products. So generally, what these studies have shown is that nicotine salt produces higher ratings of appeal and lower ratings of harshness. Now, we know from tobacco industry documents that reduction of product harshness has long been a target of the tobacco industry to increase product appeal among women. And here are a couple of old advertisements really demonstrating that the smoothness of the e-cigarette being, or of the cigarette being important for appeal. We also see in a recent study that wasn't specifically looking at differences between free-base nicotine and then nicotine salt, we see that e-cigarette smoothness and harshness, specifically as ratings, were more strongly associated with appeal in women compared to men. I'll talk more about this study in a few slides when I talk a little bit more about flavor. So taken together, really what this is showing is that nicotine type and its influence on, or nicotine type and the difference in harshness and irritation may really be a mechanism in which women and men may differ, but more research is needed. So turning towards the second feature of e-cigarettes that I want to talk about, flavor. Some information about flavor is that e-cigarettes come in a variety of flavors, including sweet flavors, candies, desserts, fruit, cooling flavors, menthol and mint, tobacco flavor, and also more unique flavors, things like spices, beverage flavors, alcohol flavors. Flavor, when I say flavor, I'm including both characterizing flavor, so things such as cherry, strawberry, and menthol, but this can also really encompass other sensory components like cooling sensation with no characterizing flavor. This is really rose to prominence in e-cigarettes, these cooling flavor components that aren't necessarily a specific flavor component, but enhance the cooling experience. As I mentioned, flavors can be multi-component. You see on this example e-cigarette here, aloe grape, multi-flavored. Additionally, these sweet flavors with cooling components. And we know that the addition of cooling components have been shown to be associated with increased product use. We also know that e-cigarette flavor and nicotine level have been shown to interact. So the harshness of higher nicotine levels have been reduced by flavor. And compared to males, we know that females report higher rates of non-tobacco flavor use, and females report using e-cigarettes for the availability of flavor options. We know that flavor is particularly relevant in this population. So what have human lab studies showed us in regards to e-cigarette flavor? Lab studies have demonstrated that flavor in e-cigarettes may be uniquely relevant to women, and there's really 3 major points that have been seen in the lab data. One is that perception of flavor may have a stronger impact on appeal in women. The second is familiarity of flavor may increase appeal. And the third is menthol and cooling flavor specifically may be especially influential on appeal among women. So I'm going to talk about each of these points. So the first point, perception of flavor may have a stronger impact on appeal in women. The study I mentioned earlier by Pang et al. In 2022 outside of the from the University of Southern California examined 10 different e-cigarette flavors tested with nicotine salt and free-base nicotine. Participants sampled all of these e-cigarettes in brief sessions, and then they rated how much the appeal of the cigarettes, how much they liked it, as well as a variety of sensory experiences. So how sweet it was, how bitter, smooth, cooling, etc. And this point of the study was really not to look at differences in the ratings of different flavors, but to look at how these sensory features were related to appeal. And so as I mentioned previously, ratings of smoothness, bitterness, and harshness were more strongly associated with appeal in females versus males. So both populations found these different sensory features to be related to appeal, but women significantly more so. The second point that we see from lab data is that familiarity of flavor may increase appeal among women. So this is a really interesting study by Cheryl Onken and colleagues in 2015. And I haven't seen this data replicated since, but I think it would be a really interesting project to look at in the future. So in this study, participants were all combustible tobacco users. They were either menthol or non-menthol cigarette smokers or people who smoke cigarettes. Participants were exposed to a tobacco and a menthol nicotine e-cigarette separately over 2-week-long periods. So participants were given a tobacco cigarette for a week, and then they were given a menthol cigarette for a week. After exposure to the e-cigarette, they were brought in for a laboratory session. Participants were asked to vape the e-cigarette in laboratory for 5 minutes. Blood or biochemical data, so blood nicotine concentration was taken, and then they also rated the liking of the cigarette or the subjective appeal before vaping it and after vaping it. And so what they showed in this data is that liking for women was influenced by cigarette flavor preference, whereas men did not display this difference. So I'll orient you to this graph in just a second, but broadly, if a woman was a menthol cigarette user, the menthol e-cigarette was rated more highly than the non-menthol e-cigarette, the tobacco flavored. and vice versa. So what you can see on this graph here is you can see ratings of liking on the y-axis and session time on the x-axis. So -5 is before vaping, 20 is 20 minutes after vaping. And then these different lines are the men and women, but split by what e-cigarette they were assigned. So the black circles were women that were assigned their non-preferred e-cigarette, and you can see that's significantly lower than the other three groups, women that prefer the e-cigarette, and then men either assigned to their non-preferred or preferred e-cigarette flavor, excuse me. And you see very similar data in regards to the nicotine concentration. So participants, women who were assigned their non-preferred e-cigarette flavor showed lower nicotine concentration than all three other groups. So women who had a preferred e-cigarette, and then men who either had a non-preferred or preferred e-cigarette. And this is interesting because these e-cigarettes were vaped ad lib, so at their own pace. And so what you can surmise here is that participants, women who were given their non-preferred e-cigarette may have been vaping less intensely, less puffs, less interested in that product. This is relevant, especially for understanding how to regulate flavors in e-cigarettes. If we're looking at e-cigarettes as a potential tool to help combustible users shift to a product of reduced harm, then having flavor availability that matches cigarette preference may be relevant. And then the final finding that I want to discuss from the human lab data is the finding that menthol and cooling flavor in e-cigarettes may be especially influential on appeal among women. So what we see from some laboratory data by Rosbrook and Green from 2016 is that among women, even low levels of menthol increase the perception of e-cigarette flavor intensity. We also see in an examination of several flavors, menthol being one of which, liking of menthol is rated much more highly in women compared to men. This difference was not seen across the other flavors, which was a tobacco flavor and 2 sweet flavors. And then we also see another study, again from Pang and colleagues from 2019, looking at 3 different e-cigarette flavors, fruit, menthol, and tobacco. Women rated both fruit and menthol more appealing than tobacco flavor, while males showed a preference for fruit over menthol and menthol over tobacco. So I just want to show you the bar graphs from this data. What you can see on this graph is the left side is males, the right side is females. The dark filled bars are fruit flavored e-cigarettes, the middle bar is menthol, and the third checked bar is tobacco. You can see that females rate fruit and menthol similarly in terms of liking, whereas males rate fruit, higher liking for fruit than menthol than tobacco. So it's important to consider this finding from laboratory data because we know that in combustible cigarettes, women use menthol at a higher rate. Menthol, again, has been a target of the tobacco industry to recruit women to use combustible products. Here are some, again, older tobacco ads targeting women with menthol cigarettes. And it's also relevant to consider menthol and cooling because, as I mentioned, e-cigarettes are now including these cooling flavors that don't necessarily have a characterizing taste, but produce that cooling sensation. So things like WS23 and WS3, and these have been seen in products that both advertise a cooling component and do not advertise a cooling component. So you can see some examples here. We've got strawberry ice, lush ice, grape ice, these multi-component flavors. So these multi-component cooling flavors are also very popular in these newer disposable products. So when thinking about women's use, these products could specifically be relevant and a target for women to use e-cigarettes at a higher rate. So what are some gaps in the literature? I think it's clear that e-cigarette nicotine and flavor effects in women is understudied in the human lab. There are a number of studies that look at both of these topics, but some are not powered to look at sex or gender differences. Some are not. Some, note that gender or sex is included as a covariate, but don't elaborate further. And it's important to really understand the distinctions between men and women in terms of response to these products. We also see a lot of investigation on the appeal of these products, but there could be more examination of reward and reinforcing efficacy. So beyond just looking at liking. And then some challenges for future research. So one challenge for future research looking at this work between men and women is really being able to keep up with the continued evolution of e-cigarettes. There, as I mentioned earlier, there's just so many types of e-cigarettes and they evolve so quickly and they drop off the market quickly and the popularity changes. So being able to design research, even with, the e-cigarettes that you have available that can inform future products is important. There's also population consideration. So most of the work I presented today was done with people who use combustible tobacco products. And people for whom e-cigarettes could potentially serve as a method of harm reduction. It's important to consider populations who are not combustible users who are using e-cigarettes solely, especially when thinking about differences between men and women. And then the final challenge for future research that I want to just mention is the feasibility of isolating e-cigarette features. So I talked about nicotine and flavor separately, but in e-cigarettes, it's really impossible to do so. There are so many flavors available. People are using a variety of flavors, unlike cigarettes where tobacco flavor, non-menthol is the most popular product. Tobacco flavor is really not commonly used among e-cigarettes, even among combustible users who use tobacco products. So when looking at nicotine and flavor, it's really hard to look at them in isolation. And so being able to design studies that well combine them is important. So in conclusion, nicotine and flavor in e-cigarettes may have unique impacts on women as evidenced by human lab data, but this research is really limited. And then when considering the role of e-cigarettes in the tobacco landscape, understanding their use among women is really paramount. So this is the first thing I have done this talk since I came back from maternity leave. So I just wanted to show a picture of what's been keeping me busy the past 3 months and just say thank you so much.
Thank you, Danielle. Let's give all of our speakers another round of applause for this great session. And if I can have everybody come back up. I think we have plenty of time for questions and conversation. People who are attending remotely, please send your questions in as well.
Hi, I'm happy to start us off. First of all, what a great set of talks. They were just so thought-provoking. I really enjoyed all of them so much. And I was wondering particularly about the work of Dr. Hartmann-Boyce and then Dr. Klemperer, Eli, where Jamie's work seemed to show that girls were at less risk of transitioning from e-cigs to cigs, which makes sense in light of the research showing that men are more driven by the pharmacological effects of nicotine and women are less, so more sensory motor, and also the stigma of smoking. And so that was like, okay, that makes sense. And then Eli showed that the women are more at risk of getting stuck, women dual users. And so I was wondering if you find that contradictory or is there, or not. So maybe if you guys could just sort of talk about those, your findings.
Okay. It's a great question. I was thinking it during Eli's presentation as well. I don't necessarily think it's contradictory, but I think one of the challenges in the data that most of the data we have on dual use across all populations, but including and particularly in, for example, older populations, is that it could be that quite a few people in those samples started with cigarettes first, and then started vaping as well. And you wouldn't expect to see the same thing there that you'd see in people who had started the other way around necessarily. So it's kind of my first thought.
Yeah, I think I agree with you there. I don't think they're contradictory, especially given that we're getting different snapshots, different time periods. So, I think the most important thing to keep in mind with the national analyses we did is that they were all dual users at baseline, self-selected. So getting those folks and then following them forward is very different than saying who's using e-cigarettes now and what happens after that, which I think was So I don't think they're contradictory, but it would be nice to see larger, longer term following through that whole trajectory from very first initiation to hopefully abstinence.
I'd like to ask Eli when his paper is coming out.
Well, this was an analysis we did just for this conference, so we have a little more work to do, but hopefully soon.
Also might as well. Andrea, your work was, I loved how you spent all that time going through gender versus sexual minority status. Really appreciated. And now I've forgotten my question, sorry. Gotta flip all my notes. Oh, I was thinking about stigma and the impact that stigma has, stigma of being a sexual minority person, sexual gender minority person, has on continued smoking, and that seems very impactful. And then I started thinking about, well, what about states where it's particularly stigmatized, like Florida, for example? And are there any data where because it seemed to me like one way of getting at sort of the mechanisms involved is if you saw state by state differences, states where it is very stigmatized, but I'm guessing there aren't any state by state data in rates of tobacco use among sexual and gender minority people.
Yeah, I haven't seen, I have the same question, and Trace and I have talked about this also, the stigma, and then in terms of gender affirming care and some of the regulations and what's happening in different states about that. I mean, our theory is that it will have an impact and does have an impact, but I haven't seen the data, but absolutely something to be following.
You all have poured over the research significantly, and I was wondering what you have seen or found, or if you have looked into looking at a demand analysis, the substitutability between e-cigs and cigs, and then what the next step is. And I was wondering about the potential that it could have for keeping up with, or at least being on pace with what the next product's going to be and what it might mean.
I'll jump in first. That's a great question. I'll use that as a plug for Mark Feinstein's poster. In just about 2
Okay.
hours, where he's presenting on exactly what you just asked.
Okay, there we go. It's like we planned it or something.
Yeah.
Andrea, oh, go ahead.
I have a question for Jamie. Such an important topic that your review is studying, and you mentioned most studies had risk bias. I was wondering if, after having gone through all of that, if you have any thoughts on what type of research we need or the qualities that a study should have in order to most closely get at causality of that important question of, the gateway effect.
That's a great question. I don't want to preempt the third bit of our project, which is going to be trying to figure out with a bunch of us exactly how to do that, and try and get some consensus around what we should be looking for in these studies. I think the holy grail, which I know a team in Bristol is looking into at the moment, is the possibility of using something called Mendelian randomization to look at this particular question. And the idea there is that if we can find some gene or genotype that kind of separate from everything to do with smoking, either predisposes or makes someone much less likely to vape, then that would be a really nice way to look at it. And the reason why that's so appealing is we've seen that used in alcohol studies, because there's a gene that just makes people react very badly to drinking alcohol. They don't do it as a result. And that kind of controls for everything else that's going on in terms of socioeconomic status and other substance use. So that's the dream. There are people looking into doing that. We'll see if it actually happens.
Jamie, I had a question, although it could probably, all of you could potentially speak to it. Thinking about, and multiple people have presented and showing how e-cigarettes have evolved over time and how rapidly it happens, and that's presumably going to continue. Do you worry about that, or how do you think about that in your analyses? Like, do you think that potentially different types of e-cigarettes could have different effects in men and women and affect the results that you're presenting?
Yes. I do worry about that a lot. So in fact, every time we do anything in this area, that's one of the limitations we list. And I think, you know, they're getting better and better really at delivering nicotine. So that is one thing. On the other hand, what I hear less concern about now than we did when we first started working in this area was the idea that visually they were renormalizing smoking because now they look so different. So I think there's all these different elements at play, which by gender and by all sorts of other mechanisms might be affecting what's happened. And certainly when we look at them used as a smoking cessation tool, I'd say over the last like 4 or 5 years, the research has been pretty consistent. But if you go back to the studies, the very first studies that were done, they looked a lot less effective, e-cigarettes, when it came to transitioning people off of smoking. And when you dig into those studies, those e-cigarettes were pretty terrible at delivering nicotine. So that was
I have a question I think is more directed to Jamie, but anybody is welcome to answer it. And I'm just wondering how an expert like you thinks about, say, in the United States in the National Survey on Drug Use and Health, we look over years and use of combusted cigarettes among youth is just record low, just dropping precipitously, and e-cigarettes exploded. And there's this idea that e-cigarette use increases cigarette use, combusted cigarette use. They don't seem to jive to me.
me neither. I think it is more complex, of course, in that there are lots of things that can be driving down smoking rates. Smoking rates were going down before e-cigarettes came around, but that decline has been sped up. And I think it's really difficult to be able to argue looking at data, let's say from the UK or from the States, that at a population level, there's any clear evidence that vaping is increasing smoking. What you hear about, though, and what I'm very sympathetic to, is concerns that in other regulatory landscapes, it could very well behave differently. And that, you know, what does it mean when e-cigarettes are introduced to populations with really low smoking rates, like in Ghana, for example? What does it mean when they're introduced in areas that don't have regulatory capacity or the capacity to enforce things in the same way we might do here? So I think there is a certain context dependency here, and all of our data tends to be coming from high income countries. And so I think I am sympathetic to concerns about what happens overall and globally when it comes to this, but I think it's difficult to look at US or UK data and say that there's clear evidence of a gateway effect. That's not what the data seem to support at the moment. Yeah. I'd be curious what others think about that.
That is my perspective as well. I didn't have the insights into differences that could occur across different regulatory scenarios, but certainly in the US, that's my interpretation.
Andrea, I had a question about, I believe you presented some data that a higher percentage of gay women had reported that one of the reasons that they were using e-cigarettes was that their family and friends disapproved, or that a doctor encouraged them to quit. Can you talk a little bit about like why you think that might be the case as compared to heterosexual women?
Yeah, it was actually interesting. In that study, they were looking at what factors would encourage people to quit. So,
Okay, right.
yeah, more of the women who were gender minority reported that that would be a factor that might influence quitting. So that's a good question. Does it relate to stigma and various stigmas in one's life?
Yeah.
Multiple identities.
Yeah.
Related to it, maybe.
Yeah. Very interesting.
But yeah, I thought those were some interesting differences. So some of the most common triggers were equally endorsed.
Right.
But yeah, some of these is where we saw differences in the number of endorsing.
Yeah.
It's also with when we talk about sexual and gender minority individuals, thinking about stage of life, and there's multiple processes of coming out and who family and friends are in relation to identity. So I think about that when I hear identity and family and friends. I mean, these questions didn't get at that.
Right.
But I partly wonder how it's related in terms of coming out
Mhm.
and circles of relationships.
Fascinating.
A question for you, Andrea. I think after identifying some of these more vulnerable populations more vulnerable to the harms of tobacco, like sexual and gender minorities, the next step is it's so hard to find ways of access to deliver treatment or overcome the barriers to treatment. So I was wondering if you could talk a little bit about, if we're thinking about as clinicians or policymakers in our state, how best to connect sexual and gender minority folks to tobacco treatment. Where do we do that? How should we integrate that?
Yeah, I think it's really going into the community and settings where the community are. And that's actually the work Trace Hines and I are working on. That's our ultimate goal, is that we see gender affirming care as these points of contact where we can work with individuals on smoking and smoking cessation. But we backed up to look at the research to see what we knew about it and what was out there already. And we're finding that there's not that much. But there are these various points of contact with different populations that I think would be great places to go. And I mean, thinking about it earlier, the discussion of cardiac rehabilitation, and that it would be useful to integrate smoking cessation. There's so many different areas where it would be useful to integrate smoking cessation. So I think going out and finding where people are and where we can interact. But these are points. I do a little research on hepatitis C and smoking cessation, and there is such little information about it. There are no smoking cessation treatments focused, and this is a group that comes in for treatment. They have a point of care. So it seems logical to hit people at that point of care. Like I said, and actually where we started the research is there were some residents at Albert Einstein College of Medicine who were interested in integrating smoking cessation into transgender care. And they approached John Shooter, who I collaborate with, who approached me, and we met with them and kind of overwhelmed them with a lot of questions. Oh, what is being done? What treatments and what follow-up? So that is actually our ultimate goal, is to try to go into those points of care, and not just for surgery, for longer term, especially. Relapse after surgery. We found in the hormone treatment review, we have one study that did talk about relapse, days to relapse for cigarette, and that's the first study we found in both reviews. So I'm really interested in that area. But I think medical settings, or if you can go into community places where people gather.
Brianna?
Hi. This question is for Andrea. So as you were talking about, some of the I guess smoking for sexual and gender minorities, I was thinking a little bit about age, and I was wondering if you could speak to the age of the people that were featured in the research that you presented, because I'm just thinking about, like, I remember reading at some point that, like, the life expectancy for somebody who is transgender is like in the 40s or something. It's like incredibly low. And thinking about how age plays a huge difference from Jamie and Eli's talks in terms of like what profile of like tobacco use you're using, as well as like, what sort of medical morbidity you're going to be facing. Can you speak to that at all?
Yeah, a lot of the research was focused on adults. Like I said, it was very, very hard to find research on youth at all. But right, when you talk about life expectancy, and that makes me think of suicide risk of suicidal behavior, and that link again between tobacco use and smoking and stress, whether it's minority stress or others, again, another interaction point that if we can work on the connection and other ways to cope with stress, mostly on adults, very little on youth. For transgender surgery, these are all adults 18 and older who would have surgery. So it'll be interesting to see in the hormone treatment review, because there may be some studies that do look at youth. Just from the ones I looked at, there's not a lot, but we may be able to actually get some information about youth and tobacco use. But it's primarily adults. In terms of age or average age, the 3 qualitative studies, I know it was on my slide, the average age was kind of late 20s, maybe early 30s. So they were a younger adult sample that was participating.
just riffing, so to speak, off of Andrea's comment, one theme that's come out today is we just have to do better in medical settings. I mean, we've talked about people having babies. We ask about what we're good at in medical settings. We ask, I think, pretty reliably whether someone's a smoker. But doing something once we have that answer, I think is kind of generally really poor. And in situations where like somebody has a recent heart attack, someone has COPD, someone's pregnant, we just, I know, and I'll speak to our hospital, we're trying to figure out, Sarah and I are working on when someone's pregnant, to get action is just so difficult. Eli and I took on a big one where we wanted to see if we could get everybody, our hospital, these were inpatients. If they come in, we know if they're a smoker, if they smoke. But we wanted some action to happen, like a referral to a quit line, unless somebody opted out and said they didn't want to be referred. We were defeated. We just could not, just the bureaucracy and foot dragging and canceled meetings. And finally, the thing about the e-record is so difficult to change, and there's so many people who want to change it. Anyhow, they defeated us, but momentarily in the battle, but we're coming back. But we are like unclear how to prevail. So
yeah, and that's a major issue. Ideally, we would integrate smoking cessation, but then who has the time to provide the services, and where's the money coming from, and where's the training coming from? Can you link to can you provide services in the clinic? Can you link to other clinics? Money. It's all about money.
We have an online question from Don Shepard. The Vermont Center's work on financial incentives shows this approach has been highly effective in promoting cessation in pregnant and postpartum women. Could e-cigarettes with low nicotine combined with incentives contribute to promoting smoking cessation in pregnant women?
I mean, I'll say
that was directed to Eli and others, is what.
Well,
Go, Eli.
I think that's a very, very good question. There are other people around who are, I think, better equipped to answer than I. I don't know if you have thoughts on that.
There are some data. There was a trial recently out of the UK, looking at e-cigarette use during pregnancy. It did have, there was a fairly decent quit rate with e-cigarettes. But I think it's another example of differences in how e-cigarette use during pregnancy are perceived in the UK, and I think some other European countries. It's seen as harm reduction and, perfectly appropriate and what we should be recommending. And I think more in the US, there are more concerns about nicotine still has some negative effects on the fetus and potentially on the infant and longer term, and how do we weigh those risks and benefits?
Yeah, I'll just add one thing we can reveal. Sarah and I got blasted in the T-Corps renewal application for proposing to do experimental research with e-cig use in pregnant women. And we got our summary statement about 2 weeks before the UK study came out. Our study was really small and pretty conservative. And the UK study had like 1,000 women and everything. So really grossly different perceptions, as Sarah put so well.
what I'd say, having very recently been in the UK, is that yes, it is slightly more acceptable there, but they had a lot of challenges getting that study off the ground as well. And though, and at a, in the general population, there is more acceptance of e-cigarettes as a harm reduction tool. That's not universal. In pregnancy, much, much, much more difficult. And one of the interesting things to come out of that study, which is by Peter Hayek, that came out, was one of the concerns always around nicotine is lower birth weight. And what they found was that actually in the women using, e-cigarettes who were still receiving high levels of nicotine, when you looked at that, there was still less incidence of lower birth weight in that group. So those were really kind of encouraging findings, but I have not heard of encouraging things happening on the back of that because of concerns similarly there as well. And I think financial incentives in pregnant people and in, to be honest, all groups of people to help them quit smoking are a no-brainer. The evidence is super clear on that. We're just societally not super comfortable with it for some reason.
Mark?
So this is a comment that was part of Eli's question earlier, of kind of medical outreach towards SGM populations. It's traditionally been, and I'm by no means an expert in this, but am interested in providing this piece of information. Outreach in terms of medical care generally, whether it's education or access to services, has always been extremely difficult in that population. This was particularly true in the 80s and 90s in terms of sexual wellness. So safe sex, STD testing, and a whole bunch of other things that were just not happening at the rates that needed to be happening to preserve health. And so I think that this is inspirational, that one of the approaches that was marginally successful, or certainly better than what they were using, something called the Kiki ball. So I don't want to explain ball culture. It would take way too long, but it's basically a dance and fashion party that happens between adoptive families, particularly around East Coast urban centers around New York City, where each of these adoptive families get together and have a big dance party competition. They started hosting these in the waiting rooms of community clinics, with the idea being they wouldn't be as extravagant, they wouldn't be as big, but if you want to come down and have a great time with some of your friends, while you're at it, you might as well pick up a handful of brochures, some free contraceptives, and maybe even get tested while you're here. And so this is one of the ways in which policymakers could get really creative in terms of lowering barriers to access treatment or education or whatever it is, in a way that was already congruent with the culture as it was. And so I think that it can, like I said, be inspirational for us as people who are interested in this to try and really get creative and think outside the box in terms of ways we can come up with incentives or reduce barriers. And so just wanted to provide that for y'all.
I think the idea of integrating treatment into community settings is important. That creativity is important as well.
Yeah, that is such a great example. I loved hearing about that. That's the type of thinking I think we need. And support, and then need support to do that.
Eli, I had one other question for you. You mentioned or showed data that female dual users are less likely to quit smoking, but that's also one of the main reasons for e-cig use is a way of just cutting down on smoking also. So even if female dual users aren't quitting, are they at least cutting down? Are there any data on that? Like, is there still some benefit of the e-cig use?
Yeah, that's a great question. I think that's something we can look at, and I plan to look at. But I don't know of any data on that off the top of my head. But I will say either way, I think it's important to recognize that the motivation to quit is still there, which, you know, the implication from that is if we have a group of people, women who are dual using, who are less likely to quit, but are still just as motivated as men who are dual using, the need for treatment is
I have a question for Danielle. Human lab studies. So just curious, what are your thoughts? The Spectrum research cigarettes varying in nicotine content seem like a really good vehicle for experimenting on sex differences and sensitivity to reinforce nicotine's reinforcing effects in cigarettes. Any thoughts on studies that should be done? It just, you know, I don't know of, there may be studies ongoing I don't know about, but I'm just curious.
Yeah, no, absolutely. So I think you're correct in that the Spectrum cigarettes, you're able to get that variety of nicotine concentration, and especially that very low nicotine concentration cigarette that is low reinforcing, is low level that might sustain dependence, right? And so I think one thing you can do is you have kind of that older data by Ken Perkins, both of the nasal spray and the Spectrum cigarettes, showing the differences in terms of sensitivity to nicotine. And so I think future work should really be with cigarettes. You could potentially be looking in combination with e-cigarettes. So laboratory studies comparing some of these e-cigarettes that have varying levels of nicotine with these spectrum cigarettes to look at as like potential, alternative products for combustible users. I think I know that your T-Core Center, the T-Core Center here at UVM is doing a lot of that work. So maybe that's what I'm talking about. But yeah, that's sort of my thought.
We have an online question from Skip Murray. Has there been any studies done on using text message support to help women transition completely away from smoking to solely using NRTs or a vape? I'm wondering if more support would help them.
I don't know of anything specifically for women. And I don't know if, I'm running a trial right now that has text message support for adults who are dual users to quit smoking. Those results are not fully collected yet. And I don't know of any others that are targeting dual use in particular.
I don't know of any off the top of my head. I think it's conceivable that there could have been some with NRT, but with e-cigarettes, definitely none spring to mind. That doesn't mean they don't exist, but
It'd be a great study.
I have a question for Danielle about flavors. So I work in the prevention field and give presentations to youth about different substances. So there's kind of a conflict right now in the prevention world about whether or not we should talk to youth about flavors in vapes. So we used to kind of give them all the information and say, big tobacco is marketing towards you by having all these fun flavors and all that. And now it's kind of the best practice to not talk about the flavors at all. I was just wondering if you had any comments or insight on that.
Yeah, I think one thing in terms of prevention that you can talk about with flavors is that in terms of maybe dissuading youth from using these products is the flavors that are in e-cigarettes, they meet this definition called GRAS, generally recognized as safe for ingestion, but that really applies to oral ingestion as opposed to inhalation. So these flavors, are legally allowed in these products and they have fit this GRAS definition, but that's for, oral ingestion as opposed to inhalation, which we don't really know the safety of these flavors. And these products are evolving so rapidly and with so many different flavors that the ability to examine if all of them are, safe for youth is maybe not there. So that's something that we talk about in prevention with our youth, maybe could be adopted there.
Any other questions? All right, maybe we will end this session. Thanks again to all of our great speakers. And we'll see everyone at the poster session later.